I'm doing orthopedic surgery, especially the hip and knee replacements. So what we're doing here is a lot of joint replacements. The facilities provided for hip and knee replacement, post-op, especially in the rehabilitation program, I think it's quite good in this hospital because it allows you to get the full support of the physiotherapists so that the post-op recovery period is shortened as well as successful. So to begin with, knee replacement, hip replacements, that's the field that I'm doing at the moment most. Also other joint replacements, but not as common as the hip and knee replacements because osteoarthritis for the hip and knee are getting very common nowadays, especially in this period of obesity and people who are not very active in their work, and especially doing housework now, or what called working from home. So a lot of them are inactive, and I think that is going to cost them their joints in the future. Yeah, minimal invasive nowadays is the main thing, where the cuts for the knee replacements are getting smaller and shorter, and that will help in the sense that the risk of infection is lesser. Patients are able to move the joint faster and able to walk faster than compared to those years where the one incision will be at least about 15 centimeters, which is quite long, but now it's getting shorter to about 6 centimeters, 6-7 centimeters. So in that sense, minimal invasive is good. And now with the help of instruments like navigation, right? I do navigation where the computer will tell us where exactly is the alignment, so that we can cut accordingly the thickness of the bone and do not waste excessively. Like those days, we use our eye to just adjust the cutting, but nowadays with the navigation, we can cut exactly to the smallest amount so that we don't waste a lot of bone tissue, and that will help and benefit the patient so that the pain is getting lesser and our patient is able to move faster. So navigation is the in thing, but in the future, there will be robotics.
So my areas are mainly hip, knee and shoulder. So I did my fellowship at Stanford University, California, and basically hip, knee and shoulder is the large joints. So a lot of people in Malaysia, especially Indonesia, Southeast Asia, in general have a lot of knee problems, knee pain, knee arthritis. Hip pain is number 2 and then shoulder is number 3. So the biggest population of patients we see are for knee. The other area we have that we really focus on in ALTY is ERAS, Enhanced Recovery After Surgery. So Enhanced Recovery After Surgery, or ERAS, means you actually shorten your hospital stay, which means that after knee replacement or hip replacement, you only stay in hospital for 1 day or less, So you come in, you have it, then the next day you can go home. And this lends itself especially well for medical tourism. So say you come from Indonesia and you have your knee replacement, you can actually just go home after 1 or 2 days, and you can go next door to our hotel next door, Somerset, and spend the rest of your time there. So it reduces hospital stay, which means there's reduced cost, less risk of infection, and faster return to normal. Yeah. So actually we have a very good physiotherapy department here in ALTY, and we can actually communicate with the patient via Zoom or WhatsApp video and give them advice on how to do. We have a lot of patients have surgery here, then they go back to say Indonesia or even Australia. I have a few patients from Australia, and they communicate via telemedicine, and we can see how their knee is doing, how they're doing the exercises. We can even talk to the physiotherapists back in their home country to teach the exercises, make sure they complete the course, the physiotherapy course. And yeah, usually it's a 6-week physiotherapy. After 6 weeks, you can be back to normal.